patient that presented today to the office with complaints of upper respiratory symptoms, cold, sore throat, ear pain, nausea, vomiting. The symptoms been going on for more than a week. She's been seen already before by a previous provider and was told that she has viral symptoms, but now it's going on for more. And then she's having also some nausea. She's not able to eat or drink, so she's not able to take anything by mouth. On the exam, she's dehydrated. So because of all of that, I decided to give her some IV fluids. The benefits of it will be because she's dehydrated, she has low blood pressure. On the exam, she looks dehydrated, dry skin, dry mouth, and not able to eat enough to maintain her hydration, and also symptomatically she looks dehydrated. I decided to give her fluids. Body aches for days now, and again, she's also immune compromised. She has chronic condition that any little virus can add more pain to her. At least she will feel better today, and also the antibiotics I'm giving her will help her to fight the rest. So this is a 1 liter or 1,000 ml of fluids. So this equals about 5 cups of water. She's supposed to drink about 8 ounces of water, which is about 8 cups a day. So if you're not able to maintain that, you have high risk of being dehydrated. When you feel sick, meaning if you have nausea, vomiting, fever, then you lose more fluids with vomiting, diarrhea, fevers, also by sweating. So it means you need more fluids to consume to be able to maintain your to be hydrated. Again, my patient today told me she hasn't been eating for last 2-3 days, unable to drink anything or eat anything. So at least this liter will help her to maintain enough to have normal blood pressure, so for her to look more hydrated. And then I'm going to have her to come back to the office. I'll evaluate her in a few days and see if this helped her, and overall to see if her symptoms got better. Okay, so again, as I told you earlier, because you're not able to eat and drink much, right? Last few days you said even more? No, you have nausea. So I'm right?
Yeah.
So I'm giving you something. This is just a regular this is just a flush, so just flushing your IV so I can connect it. So the bag has a lot of vitamins, which will be just an extra boost. You will feel better. But the whole point of it, because you're not able to drink at least 4 or 5 cups of water a day, I'm giving you, this is about 5 cups of water. So the vitamins will help you. Also, I'm giving you something for nausea and pain. Okay? So the pain medication, it's like ibuprofen.
I get it.
You got it before, but the IV version.
No, I usually get it injected.
Yeah, so this is a Toradol. It's like ibuprofen. And then Zofran for nausea. Okay. And then the vitamins, it has a bunch of vitamins. Okay. A, C, B complex, vitamin D. Okay. So
how long do you think this bag will?
So this will probably last about 40 minutes to an hour. I usually start low, just to see how you feel. Okay. If no reaction, usually there is really no reaction unless you have allergies. Okay. But we don't have allergies to vitamins because we do have those vitamins in our body. Okay. So, but sometimes if I start too fast, then you may feel a little weird just because of the bag, and then I can make it higher. Okay. So I'm gonna have you to rest. We'll make you more comfortable, and then I'll check on you in a little bit.
Okay. Thank you.
Sure. So how are you feeling?
Oh, I feel wonderful. I feel so relaxed and hydrated. I was able to snooze, and
I know you were snoozing when I walked in.
I haven't been able to sleep for a week and a half, not feeling good, and then finally got a little bit of rest and just feel little bit more rejuvenated and
That's good. And then I think the pain medication also probably helped you.
definitely.
So it's probably going to be finished in 5 minutes. It's been about an hour, so not too bad.
Okay.
And then I'll have you to come back end of the week. So I'll have them to schedule to come back. I'll reassess and see if you need any more fluids. We'll give you then. Most likely not,
Okay.
because the antibiotics will also help you too.
Okay.
Okay.
Perfect.
But anyway, when we're done, the girls will schedule you to come back.
Okay. Thank
Okay.
you.
So in 5 minutes, I'll come back and disconnect. This will help you with the symptoms. It help you to stay hydrated. The medications will help you to not have pain anymore that much
Good.
because of virus. Okay.
Thank you very much.
Okay, just put a little bit of pressure and you'll be all set.
Okay.
We just finished IV fluids with some vitamins and medications, Zofran, which is not anti-nausea medication, and also some Toradol for pain for a patient who was here with symptoms of dehydration. So I decided to give her some fluids, and again, as I said, to throw some vitamins in it just for extra symptomatic help. So she felt, after an hour of hydration, she felt much better. Her overall, vital signs improved. Blood pressure is better. She feels more rested, not as restless anymore. She couldn't sleep for days now. She was actually able to snooze for a little bit, and she feels great. I'm going to reassess her in a few days and see if she needs more. Hopefully she doesn't, but then we'll see her again in a few days. So she feels much better, and I do too.